Welcome to our movement analysis presentation. My name is Destiny, and presenting with me today is Brenda, Leah, and Amy. Today we are going to be analyzing the movement of drinking from a cup. First, we will be going through the task analysis of drinking from a cup and discussing the major muscles and range of motion involved with the task. We will then introduce you to our client, Marcia, and provide you with her background and occupational profile. We will then move into analysis of her abnormal movement of reaching for a cup. After that, we will introduce the videos of the preparatory activities we chose for Marcia and move into the videos of the interventions with Marcia, followed by the summary and discussion of the interventions and movement analysis. So as I mentioned, for our movement analysis, we chose the task of drinking from a cup. The action steps involved are reaching for the cup, gripping the cup, bringing the cup towards the mouth for consumption, and placing the cup back down after drinking. Presented here is a breakdown of all of the muscles involved in facilitating normal movement during the task of reaching for a cup, gripping it, raising it to the mouth for consumption, and lowering the cup to the table. Included in this chart are the prime movers for the movements involved, as well as the functional range of motion needed to complete the movement normally. After ensuring stabilized trunk and proper body positioning, the first step is to reach for the cup. This involves flexion and protraction at the shoulder, elbow extension, and slight wrist extension. The following steps involve gripping the cup and raising the cup to the mouth, and then lowering the cup back down to the table. The prime movers for these movements are stated here on the chart. Although there are a lot of muscles in play during this movement analysis, our main focus is going to be on the shoulder and elbow prime movers involved, including the anterior deltoid, the pec major, coracobrachialis, biceps brachii, brachialis, and brachioradialis, and their typical movement patterns involved as described on this chart.
Marcia, she is a 75-year-old female. She lives in an assisted living facility. Her medical history includes a total replacement of the left knee. She was diagnosed with dementia in 2019 and with Parkinson's disease earlier this year. Her symptoms include tremors of the upper and lower extremities, decreased static and dynamic balance, decreased coordination, mild cognitive impairment, memory loss, and safety awareness deficits. Marcia is a high risk for falls. She has had multiple falls, the most recent one being 7 weeks ago. She is right-hand dominant, has limited range of motion of the right shoulder due to a tear in the flexor tendon caused by a fall. And her caregiver reports that her pain level in the right upper extremity is a 7 out of 10. Marcia requires moderate assist with ADLs and IADLs, and her primary concern is loss of functional movement of the right extremity. So in this video, you will see Marcia drinking from a cup using a straw as an adaptive device to aid in drinking. You will notice that she keeps the right arm close to her body to avoid flexing her affected shoulder. You will also notice additional abnormal movement involving her compensation of the trunk to lean forward towards the cup to make up for lost movement in the shoulder. And the muscle groups being used are the elbow flexors and extensors, and the muscle groups being avoided due to pain and weakness are the shoulder flexors and protractors.
Go ahead and reach for your cup and take a drink of water.
Our first preparatory activity is bimanual exercise to provide gross motor skills training in functional activity and to improve strength and range of motion, improve endurance, and promote circulation of the upper extremities. The clinical skills that we used are demonstration and return demonstration, communication, and safety skills. First activity, we're going to have you, you already have your fingers interlocked, that's great. We're going to have you bring your arms keep your fingers interlocked and bring your arms out and come up as far as you can. Okay. Now bring your hands down. Okay, now I'm gonna have you just flex your arms at your elbows. So just bring your arms up just like that. Okay, perfect. And now down. Okay, and then keeping your hands like that again, you're gonna swing them to the right. So bring it across your body to the right. Okay, and then we're gonna do the same thing to the left. Perfect, thank you. Okay, so now we're gonna just leave your hands where they are and just bring your wrist upwards. So just like that, as far as you can. Perfect, and now bring it down. All right, good job. Our second preparatory activity, we do unilateral range of motion exercises. These exercises provide gross motor skill training and functional activity as well, and they also improve coordination and functional movement. And the clinical skills are the same. Okay, Marcia, so now for this activity, I'm gonna need you to use your right hand to touch your caregiver's hand wherever she places it, okay? So if you can reach for her hand with your right hand. Okay. No. Okay, that looks better. Let's use the right. Good. Can you try coming up higher again? Okay, that's okay. Okay. Okay, that's good. Perfect. Thank you. All right, so now Leia will introduce you to our intervention.
In the first intervention, we asked Marcia to complete the functional activity of cleaning the table. You can go ahead and stay seated. And then put your right hand on the towel that's on the table. And lean on that arm a little bit. How does that feel? Do you have any pain there? Good. Okay. Now with your left hand, take the cloth and wipe off the tabletop. Go ahead and try to reach for that right corner of the table there. And try to bend your right elbow so you can reach a little further. How does putting weight on your right arm feel? Is there any pain there?
A little bit when she crosses her body.
That's right. Great. Get every corner. Good.
And a little bit when it's close to her body.
If you feel a little bit of discomfort, you can take a little weight off that arm and not go as far. Okay, great. Thank you. Okay, Marcia, for this next step, we're going to do the same wiping of the table, but just use your right hand and arm. So go ahead and take your left hand there and place it wherever it's comfortable. And try to wipe the table again there. Try to get that right corner of the table, just using your right. There you go. And shift a little bit of weight there into the cloth with your, there you go. And then go ahead and get every corner there. Good.
Not really able to cross the body.
Great. One more corner. Great. Last one. Okay, great job. You saw Marsha's movement was volitional as she followed our verbal cues, utilizing visual and motor control to move the cloth on the surface of the table. Shoulder flexors showed limited range of motion as she grimaced and retracted the furthest she reached out with the cloth. Cleaning the table was an open chain movement since her distal aspect or her hands were free to move about the space. Originally, we had anticipated this being a weight-bearing activity completed while standing. However, since Marsha said she did not feel steady to stand without having both hands on her walker, we downgraded it to sitting with dynamic balance. We also graded and modified the activity from bilateral wiping for passive range of motion to unilateral wiping using active range of motion on her affected right side. With extended time and practice, the client could increase body awareness and range of motion on the affected side, which can help her to reach for her cup to take a drink with her dominant right hand. Next, Destiny will explain intervention 2.
Intervention 2 was the occupation-based, task-specific bimanual activity of pouring water into a cup. This addresses strengthening and bimanual coordination during an occupation-based task. Marsha reached for the first bottle and attempted to pour it into the first glass, but was unable due to decreased strength, tremors, and shoulder pain. As a downgrade, we then had her pour less water into a smaller glass, allowing her to complete the task with minimal pain. Additionally, Amy provided proximal stabilization at the elbow and shoulder during task performance, which facilitated an increase in functional performance.
Okay, so for this activity, we're just going to have you reach for the bottle and then see if you can pour some of the water into the glass. So if you want to stabilize the container with your left hand perfect, and then just see if you can reach. Any pain there? Yes. Okay, well, just go ahead and put that down. That will maybe a little too hard with the reaching part. Or try again with this one. Just try to like pretend it for a second. Still not quite. A little thing right there. Well, we have a smaller picture. Can you still hold it with your left hand? Okay, so that was pretty good. You're able to turn that. And then let's see if you can pour some water into it. And then just see if you can pour some water into the bowl. It's just a little bit, okay, so it's still not quite able. Oh, good, you're able to pour it.
Next, Amy will go over our results and discussions.
Here is our treatment results video.
Marsha, for this last activity, I'm just going to put your nose right in front of you, and I really want you to Yes, use your right hand to pick it off and then take a drink. For our OT treatment, our patient completed 4 of the 4 activities with modifications and downgrading and using verbal and visual cueing. At the end of the OT treatment session, our patient was able to complete a modified drinking from a cup task with right hand initiation when the cup was placed near her right hand. The patient is unable to reach for her cup when it is away from her body, and her abnormal movement pattern persists. Because Marsha has a strong support system, her potential outcome is good. The patient would benefit from OT treatment focusing on decreasing pain, increasing functional strength, and implementing a home exercise program with care provider assistance. Her challenges are tremors, right shoulder flexion pain, and impaired balance. For the normal movement pattern of drinking from a cup, shoulder protraction and flexion need to be within functional limits. Patient exhibits abnormal movement patterns due to a fall, which injured her right flexor tendon, tremors, and pain during right shoulder flexion. Due to standing instability, we downgraded preparatory activity number 1 to a seated position, and patient will benefit from a home exercise program that includes these activities. We downgraded preparatory activity 2 to provide support for the table from the table in order to achieve active range of motion. Patient would benefit from a home exercise program that includes active assist and active range of motion exercises. We downgraded intervention 1 to a seated position for safety and modified it by adding bilateral passive range of motion and then right unilateral active range of motion, and patient would benefit from active range of motion therapeutic exercises. We downgraded the pouring activity in intervention 2 by changing the height and size of the objects and moving the object closer to the patient. And she was able to complete the pouring activity with proximal stabilization assistance at the elbow and shoulder. She would benefit from therapeutic exercises that target shoulder flexion and protraction. And then Leah will give us our summary.
Clients with Parkinson's and limited shoulder range of motion can benefit from interventions that reduce tremors and improve balance. Those who have limited shoulder mobility, like Marsha, can benefit from treatments that increase range of motion, strength, and endurance. Improvement in these areas will allow the patient to complete activities like drinking from a cup with increased safety, ease, and comfort. The movements for this task are similar to those for other important ADLs, like grooming and hygiene activities, like brushing hair, brushing teeth, and washing the face and hands. Additionally, OT treatment that addresses static and dynamic sitting and standing balance can help improve trunk stability and control for increased independence. In Marsha's case, her Parkinson's diagnosis, along with recent right shoulder injury, have created a compensatory strategy of picking up the cup with her left hand to pass to her right, dominant right hand. Although we did not expect significant increase in active range of motion after one intervention, we were pleased to see that it resulted in more right-sided awareness and use of the right upper extremity to pick up and drink from the cup. When aiming to promote eating and drinking functionality with people with Parkinson's, other best practices include encouragement of good upright sitting posture, good lighting, reducing distractions to maximize performance of drinking and eating. As OTs, we must consider all client factors that influence task performance and use clinical reasoning to improve the overall client outcomes. As we're learning, improved movement increases our clients' independence with ADLs and IADLs. Thanks for listening to our presentation.
references. Thank you.